So what went into Governor Little's decision today? What factors did he consider? A lot of our leaders have been looking at COVID-19 forecast models to gauge what we do next. And a lot of them have looked at this model from the University of Washington. And it can be broken down by state. It paints a pretty picture when it looks at Idaho. You can see that numbers dropping off significantly compared to how bad it could be. However, it's not the most accurate depiction of what is happening or could happen in the Gem State. I spoke with Dr. Benjamin Reidenauer today, a biomedical researcher in the University of Idaho Math Department. He told me that UW model, basically too simplistic, and it's a more of a statistical model based on what happened in Wuhan, China. And then it just overlays that information to apply to, say, Idaho. And if you add interventions like closing schools, you get a 33% improvement on transmission. Social distancing rules would decrease transmission another 66%. And Reidenauer says if you add travel restrictions on top of that, well, that would bump it up another 33%. So just by doing those three things, the UW model assumes that you would just stop the spread of the disease and it would just go away. Well, Dr. Reidenauer has been working on a Idaho-specific model since January, and it takes into account things like Idaho's rural population, our age distribution, our travel between cities. So it's a better fit for Idaho's leaders to use when they make decisions like this. And they have been using it. But it's not a perfect model. Reidenauer says the data they need to build a more perfect model hasn't always been available.
The data have been coming in fairly consistently. We got some more data from DHW today, so that's really useful. But there are other bits of data that have been hard to track down that we would like to get, like information about how much hospital capacity we have in various areas, how long people are spending in the hospital when they end up showing up at the hospitals, and even just knowing how much testing is actually happening and where testing is going on, right? Those things are all really important to, one, getting sort of the overall burden to the healthcare system right, and then knowing when it might be safe to lift interventions or when we might have to put more strict interventions in place.
We get a lot of questions about why are we not talking about the recovery numbers. Are you guys including that in your model? And what are you seeing?
So unfortunately, we're not able to get numbers about recovery. We've asked a little bit about how people are recovering and what the time period is for recoveries. I mean, we get anecdotal evidence. So we're left sort of taking the data that we get that is about just new infections and trying to infer how long it takes for people to recover. And one of the real challenges, which I'm sure you're familiar with, is that there's this large subclinical group of people that are either asymptomatic or they just have sort of mild symptoms, right? So they never go to the doctor, and we don't really know much about that group at all. And so without doing sort of extensive testing and learning about them, it's sort of this blind spot in some of the models.
Are you concerned that the lack of testing or the backlog in testing is kind of hindering your modeling a bit?
It does hinder our modeling, right? In that we don't know exactly how many positives there actually are out there. So that slows things down a bit. That's the backlog bit. We know we can stop doing interventions when people stop testing positive for this thing, right? That's the key bit. And so if you're not testing, you don't know if you can stop, right?
True. You're not making this model public though, right?
Yeah, right now we're keeping this in-house. So we're helping, obviously, the governor's task force do modeling. We're helping other stakeholders within Idaho, so like the city of Boise and other places, run various intervention strategies and models and try to figure out what we might expect if we, say, lifted our social distancing tomorrow or today or in 2 weeks, as the new order might be, right? So we're trying to do that and provide the best information we can to the people that make policy and make the decisions, and then let them run with that information and decide what to do.
Dr. Reidenauer says he agrees with Governor Little's decision to extend the stay-at-home order today. As for the plans to make his model public, that is in the works, just not right now. There are already a lot of outside influences trying to direct decisions our leaders have to make, and he says they want to keep it more inside.